What's that? There's no, this goes to his camera, and you're holding the microphone that goes to there.
Did not get her wired up.
So I've got a loud mouth. I am happy to yell.
Okay.
I could scream. It's not a okay. And now
May I have this to you?
You may. I've had so many men in my clothing today. It's really. I'm just saying. Women my age usually don't brag about that, but
there we go.
Okay.
You hear it better now?
All right, can you hear me? Okay, very good. All right, well, thank you for inviting me. And many of you I saw last night, and some of you I've not seen. And so don't worry if you missed last night. We'll go over a little bit of it. And then tonight, though, I wanted to share more of a clinical experience. Yesterday was more science. As science-y as I try to make it. And then today is going to be a little bit more clinical with some of the references that we use in our company. So, and he mentioned it, I'm a double board certified surgeon. I'm also on the medical advisory board for a company called SuperPatch. And SuperPatch is the only company that utilizes what we call vibro-tactile technology. It is based on Nobel Prize winning science, and it is quite fascinating, actually. We are recording tonight's session, and I'll figure out how to make it publicly available to people in bits and pieces, if anything, so that y'all can learn from the lecture and share with friends. So that's a little blurb about me, basically. Yes, most of the stuff that I do on social media tends to be in the gut health arena. However, I do a lot of speaking for the SuperPatch company about neuroscience. Now, vibrotactile technology, that's this VTT. It is actually real science, and when you first hear sort of the pitch or you look at the little, what we call technology, it looks like a Band-Aid, and you might think to yourself, there's no possible way this piece of plastic does what it purports to do, except it actually does, and we have double-blinded placebo-controlled trials for most of the patches, and we certainly have EEG confirmation studies on all of the patches. That's how they are designed. And so it is a unique intervention, and I believe it represents a paradigm shift in medicine, to be honest with you. We talked last night about the difference between pharmacology and physical therapy. And so tonight we'll talk more about that physical therapy aspect. So these patches are a physical therapy device, FDA registered as a Class 1 device. There's no contraindication to using it. They can be used at any age. And we use them to correct neural pathways, and I'll talk about sort of what that means. So today we're going to recap kind of the VTT thing. We'll talk about homeostasis, which is really the name of the game. If you are in parasympathetic homeostasis, then your body can really achieve limitless results, right? This is where you heal, this is where you get your energy, it's where you get your creativity and your longevity occur in the parasympathetic state. And the problem with modern life is between our food, our water, the light bulbs in this room right now, the sounds that you might hear from the road or in music or just in the electronics, all of those things actually shift you into a sympathetic state, which is part of what drives chronic illness. So your life should be devoted to how can I spend as much time as possible in a parasympathetic homeostasis, and that is what this device does. So we're going to talk about that. We're going to talk about the current targets that these patches will hit. There are many, many different neural pathways in your brain. Every physiologic process of your body is controlled by these pathways. Each physiologic process has its own little pathway. And so you truly can tap into that individual pathway with this technology. There's probably 12 or 13 on the market now. There's another 5 or 6 in the wings waiting for our placebo-controlled trials to show efficacy, and then we tend to launch those. And then I was going to publish, I don't know how many of you guys are actual practitioners, but even if you're just someone who's looking for your own health, I'm going to publish or present 2 different protocols that I use in my practice. I have two practices. One is a wellness practice. We used to be an in-person med spa. We did a lot of weight loss in the med spa. I've just transitioned that practice into my online persona where we're really just talking about gut health. And this way I don't need employees, it's just me. And then my surgical practice, I have a protocol for post-operative healing, but you can use this for any operation, any injury that you might have, even if it's a twisted ankle, the concept is kind of the same. It doesn't matter. One of the concepts we talked about yesterday is whether you know it or not. Every cell in your body, including your microbiome, the bacteria, any biologic system has the ability to sense light and sound and vibrational touch. And this is Nobel Prize winning science that described this, but all biologic life has this capability, and our bodies actually use signals, even though that they're light and sound, and I'm not talking about your eyes and your ears, I'm talking about the cells of your body, in particular the skin, can communicate with your brain and adjust your physiology through your skin. So in 2010, a sort of a gee whiz paper, it was one of scientists, Scientists don't typically take care of patients. They don't always have a clinical bend to what they're just answering a question of interest. There is a lot of interest in the world of Eastern medicine, like why for 3,000 years have we known that acupuncture and acupressure work? Like, why do they work? How do they work? It almost doesn't make sense. The Western world doesn't really acknowledge that it even makes sense because the Western world works in a world of chemistry. And so this study explains essentially the healing touch. This is why you can touch someone and calm them down, or touch someone and make them very angry. So there are signals that do not require your eyes or your ears and can completely change your physiology for the better or for the worse. The science involved in that is what's called a piezoelectric channel. For probably the lay person, that's a big word maybe, piezoelectric. It just means that you're taking a mechanical force and turning it into an electric signal. Your air conditioner thermostat does this on a daily basis. It simply takes the temperature of your day, it alters it, and then turns on and off an electric switch to turn your air conditioner on and off. This is not a unique function to biology. In essence, your thermostat in your house is mimicking your own biology as a result. We call that a piezoelectric channel, and it can turn any electromagnetic vibrational force into an electric signal that can be then propagated down a nerve. So every nerve in your body is connected to every cell in your body. It's a little disturbing to think about, but even one cell can set the cascade of communication to your brain to adjust the physiology to the rest of your body. This is just how God made us, which is fascinating to me. You don't need special cells, right? So when I gave the example yesterday of like a bug crawling on you, and today as I'm sitting by the pool, I was reminded of a night 2 years ago, and I live in Texas, and we have a outdoor pool, and we have a little whirlpool associated with the outdoor pool. One of our favorite things to do is turn on the whirlpool and just no lights on. We live in the country, you can see the stars. So I hop into this whirlpool and I lean back and I can feel something squirmy, wiggly in the water. And of course I leapt out of the water. It still gives me the heebie-jeebies to think about it. My husband instantly recognized there was a problem. He slaps the water. He can't see it. It's dark. He knows what he has, and he launches it into outer space. And so it's a little baby snake, and we're guessing it was probably about this big. But neither one of us saw it. But we both felt it and knew what it was by feeling it. Every single one of you have had this experience where a bug crawls on you. You know what it is. And it can be on any part of your body, and you know what it is. It's in that paper that won the Nobel Prize, it basically outlined that if your skin has felt a sensation anywhere on your body, if you feel it anywhere else on your body, you know exactly what it is. right? So if something you're accustomed to touching with your fingers, if it touches your toes, you know exactly what it is, right? So that was the whole point of that science, which is kind of how it won the Nobel Prize. Like, that's pretty freaking cool. Now, the engineer who owns the company who designed these products he's a computer engineer. And he's done what all the engineers of the world do. They take somebody else's bench work science that has no known application, and then they apply it to a human condition that has no obvious answer. And so that's kind of what's happened here, is that he has taken known science, turned it into a technology that has a human application for your benefit. Now, we all know, kids don't grow up properly if they don't get sort of hugs from mom and dad. The microbiome, your gut, actually requires communication with your body, and so touching your skin actually does affect your gut, believe it or not. Because this can occur with anything in life, it allows us, or Jay Dollywall, to design something that can then directly program into your brain to set signals back to normal. So the purpose of this technology is to put you into an autonomic nervous system, parasympathetic pathway balance. That's the whole point. The autonomic nervous system, for those who may not know, this is the part of your body that works automatically. It starts from the central aspect of your brain, and it will coordinate everything, not your emotion. It ties stuff together. This is why seeing a spider, even if it's like a picture of a spider, can set you into a panic if you're scared of spiders, right? Like, it doesn't even represent a threat to you. There's something about the brain that can tie everything together, give you memory, give you emotion, and then have your body respond to that. And so that's all that's what we're tapping into in regards to the patch. So homeostasis, and again, I try to define science words because I don't know the audience that I'm speaking to, but homeostasis is just balance, It's like hula hooping, It's whatever that action is that keeps things in balance. So for every signal that goes into your brain is going to send out 3 or 4 different signals to offset it. So your brain is constantly making adjustments for its environment. So when your blood sugar is 120, it's not just your blood sugar that we can measure your brain's response to that blood sugar. And so there was a paper that came out maybe a year or so ago that showed that, look, I could do an EEG of your brain and tell you every disease that you have. You may not exhibit a symptom of those diseases yet. Your brain knows before the rest of you knows. And so an EEG is a critical part of the technology. That is how each of these patches are designed and confirm that they address the part of the brain that we're trying to target. Okay, so balance basically occurs because of a communication with a tactile technology. And this is just kind of a repeat. Oh, I got ahead of myself, my goodness. But the brain will give you almost a fingerprint of what your health is, and we can check that. What Jay Dollywall by profession is a computer programmer. He's a computer engineer. He designs complex supercomputer models, and his job prior to opening this company was to take complex systems like power grids and that sort of thing, find where the thing is not efficient, and make it more efficient. So he's accustomed to taking extremely complex electric systems, computer-driven systems, finding minute changes, and then adjusting them to perfect a system. In his mind, a computer and the brain are identical, just one is biologic in its function, but they function the same way. There's input, there's output, it's electric. Okay, so your brain is communicating at all times with the periphery of your body and each and every one of those cells, and I think I talked about that a little bit. Now, what's interesting, in the modern world, there's a lot of false feedback that can occur, and I think some of that is how we get ill. The goal of all of us, I'm assuming, at this conference is to discuss ways that we can avoid getting ill or we can make ourselves better. In my opinion, with technology like this and proper nutrition, I suspect human illness does not need to exist. But you can get crazy feedback from all the wrong places, your gut. If the bacteria in your gut are out of balance, they're the ones that make your neurotransmitters. You are not going to think properly if you don't have proper microbiome. Inflammation in your body, the things that you are consuming, water you're drinking, etc., causes inflammation. That's going to throw off the system. If you have a hormonal imbalance, a lot of the chemicals we use, whether it's a scent in aftershave or whatever, all these artificial scents, these are all hormonal disruptors. Glyphosate is a huge hormonal disruptor, and they're in our lives, and all of that is sending the wrong signal to our brains, because your body itself, not so smart, right? So if it sees something that kind of looks like something important, it gets absorbed. It's up to your brain to say, holy smokes, why did we do that? Knucklehead, right? So the brain is constantly telling the body, okay, yeah, you need to unload that. That was the wrong thing. At some point in time, the brain gets tired of working that hard because we're not listening. When that happens, you reach something called allostasis. It's the new normal. Now all of a sudden your blood pressure's a little elevated. That's your new normal. Your blood sugar, that's your new normal. These allostasis set points will happen long before you exhibit disease. So the point in life is to try to get to you before you've hit an allostasis, and certainly before you hit symptoms. That's the whole point. Now, because the brain is the biggest supercomputer in the universe, actually, it is in control of everything in your body. It's connected to every cell in your body, and because your skin, and every cell in your skin, is directly connected to that brain, you can adjust your own physiology with the coordination between your brain and your skin. This is just known, and this is the basis observation of acupuncture and acupressure. The difference between acupuncture and acupressure is it takes an incredible amount of training to learn how to do those things, and they are site-specific, and they are limited to the time during which you're doing the therapy. We are looking for an answer that allows your skin to communicate with your brain as a continuous touchstone of normalcy without you having to know anything. You don't need any training for it, and anyone can apply the patch. So basically, biologic systems, in recap, are going to communicate with these signals, okay? Your brain is going to have a response to that signal, and all the nerve endings in your body are connected to the autonomic nervous system. For you to be in optimal function, parasympathetic homeostasis is kind of what I'm trying to say in a roundabout way. Now, the problem with what we know now, and we talked about acupuncture and acupressure, some other things that y'all may have engaged in is meditation, perhaps, or even biofeedback. There's a really cool, I don't know how this works. There's like a neural feedback. Have you ever seen that? It's like a little helmet you wear and like reads your brain waves, and then you can train yourself to focus in your brain wave. The purpose of doing all these things is to train yourself how to tap into your vagal nerve, which is connected to the autonomic nervous system, and then get yourself into parasympathetic homeostasis. So you'll see a lot of stuff about vagal nerves. Surely someone has talked about vagal nerve stuff I'm assuming, because it is that important. That central nerve is your key access point of your gut to your brain, and it's the key access point of your blood supply to your brain, and you can control it with meditation and biofeedback and neurofeedback. The problem is it takes years to learn how to meditate. In my opinion, if you're ADD like I am, that is never going to happen. Like, I don't think I've ever sat for longer than 15 seconds without having a thought. I think all night while I'm sleeping. When I was in medical school, I was studied while I slept, and which is extraordinarily annoying. It does make for good grades, but it's annoying. And so, you know, who's got time? Nobody got time for that. So we're looking for, again, something that you can stick it and forget it, and that's the whole point of the technologies, is stick it and forget it. We call the process of learning meditation and those kind of things. Biofeedback is operant conditioning. You're just giving yourself a feedback that's positive, and you're learning how to do something. You're training someone to do that, but you lose the effect, right? So if I'm like in my Zen place and I'm driving, the second someone cuts me off, the F-bombs are coming. I'm sorry, because as soon as you mess me up, that's it. I'm back in AAA personality mode. Okay, so the good news is this: you don't have to be an expert meditative person. You don't have to invest in expensive biofeedback equipment. There is a very inexpensive technology that is now on the market that allows you to enter into perfect homeostasis without any effort on your behalf, okay? And that's the vibro-tactile technology is what we call it, and it is made by a company called Super Patch. Okay, that's the stick it and forget it that I kind of talked about, and I would consider it, when I say the word touchstone, I don't know if y'all get what I'm saying, but imagine you're in a dark hallway, or you're in a hallway, someone turns off the light, your first instinct is to reach for the wall, to touch it. That way you can continue walking down the wall, and you know where the wall is, and you know that you're standing upright, and you know how to navigate, because you're touching something that you have reference to. These patches give your brain a reference point for normal. It's like that wall in a dark hallway. Now, each and every one of your neural pathways has a different input, so there's a different code to tap into it. So when you look at these patches, and I'll show you in a minute, they function a lot like a QR code. You know, I'm going to show you a couple QR codes tonight that I hope you follow, but every QR code is unique. It's going to take you to a very specific website. You can't keep taking a picture of it and expect to go to a different website. You're only going to go to that one. It's specific. These patches function in the very same way, right? So if you are hurting, putting on the one that helps you sleep is unlikely to help your pain. Okay, so they're very, very specific, and for this reason, you may need to wear more than one. Like, I got 6 of them on my body right now, because I like my brain in pure green. I like the green energy, you know, as it's Saint Raphael, the archangel. It's a green healing patron saint of physicians. So I like the green. What's that? Vibrotactile technology then. So these are the pathways currently that we have on the market to address, and there's others coming. So they include pain, sleep, anxiety, depression as well, immunity, hormonal control for men. Female hormonal control is more than just a neurologic pathway. It's a combination of multiple neurologic pathways. You probably need 3 or 4 patches to tap into the female hormone cycle. But for men, it's one patch, one pathway, luteinizing hormone, boom, you're there. So then circulation, metabolism, get your focus, athletic augmentation, and probably among the more popular patches, especially with younger people, are going to be the Victory Athletic patch, because it helps them compete. They're professional athletes, Olympic athletes that use these patches. What's beautiful about them is at any age, no matter what your medical history is, no matter what your allergies are, what medicines you're on, if you've ever had surgery before, none of that matters, because the patch is going to work in 99% of the human population. The 1% where it doesn't work typically have a disconnect in the neurologic system. So they're either paralyzed, or they have some other neuronal aberration, or the patch isn't making contact with skin, or it's on a piece of skin that does not have sensation. And I'll give you an example to that, because we're going to talk about other things in a minute as far as my clinicals. But if you have someone who has pain, there is a pain patch. And actually, this is how I met Jay. After my vaccine that I was forced to take against my will, even though I've already had COVID, and that's a different story. I developed an extreme autoimmune disease, which caused horrible total body, total joint, autoimmune inflammation. Pain. Well, in my profession, I can't exactly take narcotic pain medicines, and narcotics cause inflammation anyway. I wouldn't have wanted to do that. But I was struggling with the pain. I was on all kinds of medications, and he sent me a pack of freedom patches, and I put one on the knee that was keeping me from walking upstairs in my house. And before you know it, I'm running up and down. And I mean, I literally got my life back. I got my surgical practice back as a result of that patch. And so that was kind of the venture that I went down. If you are a diabetic and complaining of peripheral neuropathy, you actually don't have proper sensation in your feet. That's a phantom pain. If you were to put that pain patch on your foot, you probably would not help that pain because you don't have sensation on your foot. So if you have a family member with pain, you're thinking, holy smokes, I need the freedom patch. Don't put it on the foot where they don't have sensation. Put it up higher on their leg where they do have sensation. You've got to have an intact sensory nerve for this pathway to work, if that makes sense. And I may have gotten ahead of myself just a smidge. But basically, this is kind of how the world works. This right-hand side are skeletal muscle fibers, and each one of them has a little tendril from a nerve. Like every single cell in your body is connected in this way. And this is a computer graphic of what vascular supply looks like, but this is how your body controls every function in your body. All of those nerves, every road leads to Rome, is going to go up your spinal cord to the base of your brain, and is going to be able to hit the central aspect of your brain, and depending on the pattern on the patch, will move either to the forward, to the back, laterally, or in multiple directions, depending on how it's designed and what neuronal pathway that he is targeting with the patch, if that makes sense. Well, what's up? Why won't it go? Oh, there we go. There you go. So that's the technology. It looks like a Band-Aid. I know you're thinking, what the hell? What's in it? There's nothing in it. There's no medicine in it, okay? There's no medicine in it. It is a pattern, and that pattern is actually on the sticky side of the Band-Aid. On the other side, you'll think, well, there's a pattern there. Yeah, that just makes the patch flexible. So when it's on your skin, it kind of sucks in a little bit of skin so your skin can interact with it. As your skin moves, the pattern has a slight vibration. That is the vibral aspect of the technology. So as the patch moves a little bit, that little texture vibrates and triggers these piezoelectric cells, and then as that's done in a pattern, it sends an organized communication to the central part of your brain. That's kind of what's happening. Now, what's important to know is, just like we talked about QR codes, I mean, this is like computer programming. If the signal is interrupted, it's not sending the signal, right? So if the patch is not making contact with your skin, signal not being sent. If the glue is worn off, if it's fallen off your body, if you cut it somehow, it's not making connection, then you're not getting the signal. The other thing to keep in mind is that if a pathway is already perfect, you can't make it better. Now it is interesting, because we were talking earlier, and I do not see him in the room. Oh, he told me he was going to come. Do you see how that works? If I see that guy again, he's in trouble. All right, anyway, so, because he asked, he's like, he used to be an athlete, he wants the victory patch, which is our athletic performance patch. He's like, so I'm not looking to be an Olympic athlete. Is it gonna help? I said, well, interestingly enough, Olympic athletes, like as prime as they can possibly be, actually see an improvement in athletic ability with a patch. So no matter how optimal you think it is, probably not optimal. That study on D1 level athletes in athletic endeavor and that victory patch was done at the University of Arizona, not far from here, and showed a statistical significance, P less than 0.001, of improvement in athletic endeavor, reflex speed, strength, recovery, decision-making skills with that patch. So there's real science behind it, and I know you're thinking it's alien technology. I have accused the owner of this company of being abducted. Perhaps he is an alien himself. Is there a mask? I don't know. He says it's just computer programming, Anna, and I don't know if I believe him, but it's brilliant regardless, right? So key concepts, if you were to engage, now, and I will invite you in a moment to where the booth is in the vendor area, but don't think you're going to get more for your money by cutting. It's not like an aspirin where you can take half an aspirin, okay? So you can't cut it into little pieces, okay? You have to use the entire patch. The only person that knows what the texture looks like or how big it is or where it is on this patch is Jay Dollywall, and he's not telling everyone. He says all four corners, the whole thing needs to make complete contact. Because if it isn't, the signal's not being sent. So you need to make sure that whole thing is making contact and a piece of skin that's not going to get disrupted. So I have a tendency to put them right here and here. I stand all day long. I don't get up and down. And this way it's protected by my clothes and not getting ruffled. Everyone has a different spot. Some people use the front of the arm. Most of our studies are done with this forearm skin right here. But as a surgeon, I'm washing my hands all the time. That just doesn't work for me. But once you can't think to yourself, well, I put this patch on like 4 hours ago, but I want to take a nap. I don't need the boost patch anymore. I should take it off like a piece of gum and stick it on my nightstand, and I'll just wear it tomorrow morning. Doesn't work. The second you take it off your skin, you've damaged the pattern, unfortunately. It's embedded in the stickum. And so once it pulls, the patches are manufactured in Minnesota by the 3M company. And so it's hypoallergenic, but once you peel it off, I don't know the magic about their glue. It kind of doesn't stick back. You're not going to be able to put it on the skin, like tape it down and think it's going to work. And I have patients do that to spread, like, oh, I just wore it for an hour. I'll just take it off and put it back on. It doesn't work that way. So if a person is trying the therapy and it's not working, there's a number of reasons that could be. Either, number one, they're addressing the wrong pathway. I can't sleep and your REM patch is not helping. Well, it's possible that your REM organization in your brain is actually working properly, but you can't sleep because you have an anxiety disorder. You're thinking all day long. What you really need is a peace patch to calm down that anxiety thought, right? So interpreting the proper pathway is actually very important. And the other issue is maybe putting it on a piece of skin that moves too much, so it comes off, or it sweats. Some sweaty people. My husband's a sweaty dude, and he's hairy. He's like a bear. He's like a hairy, sweaty bear. So there's like one spot on his body right here that if I put a patch on him right there before he works out, especially now that he's got a dad bod, which he's trying to get rid of, but it's the perfect smoothness for a patch. So he can't get rid of too much of the dad because perfect. And then it stays on while he's working out. So you know what I'm saying? So you want to find a perfect piece of patch of skin. Okay, so just in a recap on the technology. So this technology, these are considered devices. The FDA considers this a physical therapy device. So when I start talking about the protocols, I'll have a conversation for the doctors and chiropractors in the room, people who take care of patients, because as a physical therapy device, that's now a reason for you to interact with a patient as a physical therapy visit, and insurance codes do apply for physical therapy visits. So you can bill insurance for the visit. Now the insurance is not yet paying for the patches, but we are in talks with Anthem and some other insurance companies to put them on formulary like K-tape. So that way patients can use their insurance to talk to their doctor about this technology and use their insurance to purchase, or at least an HSA card. So he's working on those demographics right now, but whatever. So it's not a medicine, it's not gonna replace a doctor, and each one of these patches is a little bit different. I know it's frustrating because everybody wants one. I've asked Jay to make underwear, just make underwear that I can put on every day, that hits them all, and he says he's probably not gonna do that, but I have asked him. So if you ever see super underwear, that's me, baby. That's me. That will be my influence on the company forever. Okay, so the two things, and I think I alluded to this early on, there's two pathways that I use this patch for. One of them is for what I call a clean patch protocol, and you are free to steal this. I don't make money in the weight loss program anymore. Don't care. Feel free, take pictures. And then my enhanced recovery after surgery, and of course, all of that is common knowledge, published. You can Google search any of that information, then I tell you exactly how the patch applies in that pathway. Okay, I talked a lot of that, right? So this is safe in pregnancy, it's safe in breastfeeding, it's safe in children. I would tell you, however, it is plastic. If you got a kid who's a picker, put it on their back where they have no access to it, underneath a tight t-shirt so they can't grab it and choke on the plastic. That's the only thing I'm going to say. But this may be how you figure out if someone is human or not, but if you're human, it's gonna work. It's not gonna work on your pet. We don't think it works the same way for pets. I don't know, it's never been tested. So I don't think you can put one on your dog and have it calm down or sleep better, sorry. But you can put it on a child, right? So, now it is also important to know that you're not gonna feel anything, right? So I got 7 things on me. I'm not buzzing around, like this is just normal me. I know it's hard to imagine. But it's not like you just slammed a Red Bull and your pulse is going and you got like, let's go. It's not gonna do that to you because there's no chemicals. You can't overshoot the pathway. You can't make your heart race, you can't make your blood pressure raise. It's calming everything down to normalcy. It's not gonna make you unconscious, it's not gonna sedate you, right? So this is why I, as a surgeon, love this stuff. There are no narcotics in it. The patient doesn't need a prescription. They cannot possibly overdose themselves. They're not going to get so sedated taking a sleep medicine, an anxiety medicine, and a pain medicine right after an operation and then wind up found not breathing, you know? They're not going to get up in the middle of the night and trip and fall and hit their heads because they're so sedated. So these things are important to me as a surgeon and to you as a parent. This may be important information. So you don't feel the difference. You just recognize, I don't think about my pain anymore. Or, how did that dude cut me off in traffic and I just didn't flip him the bird or like do something angry or just like ruminate about it? Oh, it's because the peace patch totally kicks ass. In fact, the peace patch is the one that it took me about 8 hours to realize I wasn't flying off the handle in the operating room. I'm a pretty typical surgeon. I like things just right. I've been in the same hospital for 21 years. I have done tens of thousands of operations in that hospital. And they screw it up every single case. Like, how do you not have that suture? I ask every case for it. And normally that would get me upset, but you know, in the modern era, it's sort of like I just make a joke about it now, you know? So that's peace patch, baby. So anyway, it gets you to optimal function. Now, if you were a patient, we talked about this a little bit, they're not yet insured, but stay tuned. If you are a practitioner, we'll talk about how it applies to you, but anything you purchase from a practitioner is eligible for HSA purchase. So if you are getting patches just in person and not online, that HSA card applies. If you're buying online, the company does not quite yet have the ability to accept an HSA card. That's kind of the point that I'm making. The set of patches is like 28 patches, and correct me if I'm wrong. I'm thinking by the time they pay taxes and it's shipped, it's $70 for a pack, roughly 68. What do you think? We're shipping somewhere like that, depending on where you live. It's an international company. There are people all over the world who are using these patches. But so yeah, like 70 bucks. Now, I think personally it's worth it. However, make yourself a little online account and have them send patches to you every month, and now you get a 25% discount. Is kind of what I'm saying. And then the booth will have some deals, first-time sign-on discount deals that you can have. So some of you may be business savvy and think, that's cool. I have a med spa, a beauty salon. I have a massage thing. We sell wholesale retail all the time. Cool. You might be interested in the business model for the company. That's not really my purview. I don't know much about it, but I'm sure Valerie does. Now, if you're a practitioner, this is kind of more my wheelhouse. You can get a Health Pro account. And it's cheap. Is it free? It used to be free. Yeah, it's free. Okay, that's what I thought. It's a free account. You have to have an NPI number. You just get to prove that you're a health practitioner. You can buy these patches at 50% off and then sell for a wholesale retail price of your choosing, knowing that if someone is buying it online and they're not getting a discount and it's being mailed, the value of that pack of patches is around $70. Except you're going to buy them for around $32. So there is a monetary, I'm going to buy them wholesale and I'm going to sell them retail, okay? And that's kind of important. For me, one of the things that's important is that it is not a medicine. So stark regulations do not apply. If you're a physician or a practitioner who understands it's against the law for a doctor to have a pharmacy, then you don't have to worry. That's why you go into your regular doctor's office and you see nothing for sale. They won't even give you a name brand of a damn vitamin to buy, right? But they'll write a prescription for the single most expensive medication. Why? Because that doesn't cost them any money, and the law requires that's what we do. We're not allowed to give you our opinion on something that's not a prescription, believe it or not. So in the world of physical therapy, crutches, knee braces, K-tape, super patches, that you can have available for your patients because it's a physical therapy device. And that is an important thing for the average doctor to understand. You can code an E&M code, 99213, established patient, 25 modifier, means it's not the only thing I did today. You can add a conversation about physical therapy and apply a patch to the patient, and bill code 97112 with a GP modifier, which means physician-directed physical therapy. That code will garner you a little extra money. It's not much, but it's enough to pay for that patch, that conversation, and it makes it worth the physician's while. So patients could kind of know that. That way they can utilize this with their own insurance, if that makes sense. Okay, so protocol number 1. Oh my God, I'm running long. I'm so sorry. I'll blaze through it. Y'all probably know most of this information, but what I call a clean patch protocol. Why is it not? GLP-1 is like hitting a craze right now. Is there anyone not on the GLP-1? Really, honestly? Almost every medical society now starts with use of GLP-1 to improve your heart health, your blood sugar. Like, they won't even talk about diet and exercise anymore. They go straight for this GLP-1. It's uncommonly expensive, and the pharmaceutical world wants you on it for the rest of your life. There are horrible complications with GLP-1, which is one of the reasons I stopped my weight loss programs. Too much risk to me. You can have blindness, you can have heart, bless you, heart wasting, muscle wasting. There's all kinds of complications that can occur, and they occur within the first 45 days of starting the medicine. You don't have to be on it for a year to become blind, just so you understand the risk of that medication. So it is not only uncommonly expensive, it takes a lot of education to teach a patient why it is they got fat in the first place, and to earn a living in the weight loss gig. GLP-1 is awesome because you just give someone a medicine, they pay for it, they leave your office, you collect money. That's why everyone likes it. I'm telling you, it is not good for you, and we're gonna find untold damage to our population. They're starting to give it to kids. I think it's a travesty, but anyway. Okay, this is for, if you're trying to lose weight, this is the magic, okay? It's very simple. There are 6 things that it takes for your body to naturally remodel the way you want it to remodel. Period. There's no magic to it. You don't have a deficiency in Ozempic, okay? There are 6 things, okay? Number 1, you have to eliminate all toxins. It's why I put people on a clean diet, grain-free. You have to manage your blood sugar. A caloric deficit is required. I am so sorry. It is miserable. I understand. You need to maintain your muscle mass, so you got to do some weight resistance. You don't need to run 1,000,000 miles a day. That's actually too stressful as we get older, especially for women. Like, you can't lose weight doing that, but lifting weights is important. You need to retrain your gut microbiome, and then you need to get rid of stress. You need to get out of the sympathetic, and you need to get into the parasympathetic. And if you can do those 6 things, your body will naturally become kind of what God intended, okay? Elimination of toxins. I put people on a clean diet. This can be the hardest part. Processed food is addicting. It is very difficult. When I tell someone to go grain-free, they act like I just killed their puppy. It's like the worst, like, what am I gonna eat? So, right, if you're saying, what am I going to eat, when I say no grains, right, so that's no wheat, no corn, no oats, no quinoa, no rice, and everyone's like, oh my God, what am I gonna eat? That means you've spent your entire life getting your calories from grains because the FDA told you to. And I'm telling you that pyramid is upside down, okay? So no grains, you don't need them. Your body does not need grains. There are some B vitamins that you get from grains. That's always the argument that people will give you. Oh, but what about the B vitamins? I mean, you can eat some mushrooms and get your B vitamins, okay? So you don't need the grains, get over it. And if you're addicted, and I am horrifically addicted to sugar, and you give me one little bit of sugar and that's it, I fall off the rails. Super Patch does actually have a patch for the addicted personality type who's trying to quit something. It's called the Kick It patch. It's the power of positivity. There is a pathway in your brain. If you know what you are doing is wrong, you can quit doing it with this patch. Now, if you don't know it's wrong, you're not going to quit doing it. Like if you think, well, grains are good for me, Kick It patch not going to work because your brain thinks it's good. The second you realize it's bad for you, that is a different thought process, and that's the thought process that gets normalized as a result of the patch, if that makes sense. So if you're smoking and you know chain smoking is bad for you, there's an aberrant pathway that knows. It knows. That's the devil on your shoulder, and it knows. And the patch calms that down and gives you just enough time to resist it. Now, you can override it at any time because when you're doing something bad, damn it, you're just doing something bad. And you know you're doing something bad. That's why you started smoking in the first place, right? So you can override it, but I'm just saying, so I use Kick It patch in the diet protocol to help people comply with the clean diet that I suggest. Okay, managing the blood sugar, and I do have patients trying to lose weight get a continuous glucose monitor or just check their blood sugar frequently. If you are eating multiple very small meals per day that are mostly protein in a small amount of vegetation, you're going to have managed blood sugar. There's no grains, there's no sugar, there's no artificial sweeteners in there, nothing that is white, there's no potatoes, there's no cassava. I'm not just talking about being gluten-free, I mean there is no starch in your life. And multiple small meals every 3 hours. Your blood sugar will be rock stable as a result doing that. You can control your blood sugar naturally through your diet by doing that. There is a patch coming out. I just want to say it's not hit the market yet because we're struggling with the FDA on claims. So where am I going? Calorie deficit. Got to have a calorie deficit. How do you do that? She's like, you work out more than what you consume, right? You can optimize your metabolism and improve it by up to 25% using a patch called an Ignite patch. I personally find that I can't sleep at night with my Ignite patch on. Some people can sleep like babies. But it's designed to be worn 24 hours a day as an extra little calorie burn. I have all of my patients wear that for as long during the day as humanly possible. If they could sleep at night with it on, then I make them sleep at night with it on. Anything that causes you to burn more calories than you consume will help you lose weight. Muscle maintenance, working out without hurting yourself. There's a challenge when you're old and fat. And then look at me, I had this autoimmune issue. I gained 30 pounds because they had me on steroids, and now I'm trying to lift weights, and I don't have any balance, and I don't have any coordination. I'm going to hurt myself, and I'm a surgeon. That's how I make a living. That kept me from working out, actually, for a long time. And so you'll want to augment a person's ability to have balance and coordination when they exercise. I'm not looking for anybody to be in the NFL. I'm just looking at you not trying to hurt yourself, you know, Grandpa. That's all we're trying to do. And so a victory patch when you're working out can help you do that. Okay, you want to build muscles. Now the microbiome is kind of my wheelhouse. What helps the microbiome is a clean diet that's high in prebiotic fiber. I have a lot of patients who actually feel better in life on a carnivore diet. I make them take an inulin supplement to improve their microbiome, and I make them take phytophenols by way of freeze-dried phytophenols, you know, field of greens and stuff like that. You know, that's like straight from the field. It's organic, non-GMO, freeze-dried. It has never been in a grocery store sprayed with stuff so it lasts longer on a shelf. The company that I use is out of California. It's called Micro Ingredients. They don't do any advertising, which I love about them because they're inexpensive. It's all organic. It's American, you know, America. And so if you're doing inulin and some phytophenols, and you can control your stress, you can retrain your microbiome. The QR code on here will take you to a company called Viome, V-I-O-M-E. And Viome does microbiome testing. They will actually take an HSA card. So if you have an HSA card, I suggest everyone do it, to be honest with you. They will change the way you eat. They'll give you a 3 to 6 month like sort of menu of do not eat this, but eat lots of this. And by making that shift, you'll reshift your entire microbiome. And that is every known chronic human illness starts in the gut and has dysfunctional microbiome. You can do a microbiome test and I can tell you what your disease is. So if you can get your microbiome balanced, you'll fix yourself out of a lot of illnesses and you can normalize your weight as a result. You don't have to take a $200 a month probiotic to get there. You need to have a clean diet, inulin, phytophenols, no inflammatory foods, and it will naturally happen. That's the most important thing. Reduce your stress, and there's 2 ways to reduce stress. Number 1, get enough sleep. We have an REM patch, which helps you sleep, and then a peace patch, which helps offset kind of the AAA personality. And that's the one that I do not leave home without my peace patch. There are studies, and these are double-blinded, placebo-controlled trials published in the medical literature. One of the reasons these patches are registered with the FDA is so we can do human clinical trials. It's against the Geneva Convention to test anything that is not registered with the FDA. So they're all FDA registered, and then there's clinical trials ongoing, and this is just a couple of those papers that basically say with a REM patch, you're gonna fall asleep quicker, stay asleep longer. And then with a peace patch, basically, you can control anxiety based on questionnaires, but also on EEG testing. You can see a meditative state that occurs just within seconds of the application of the patch. This QR code will get you to a free download if you're interested in any kind of weight loss stuff for yourself. And that website is basically natural ways to curb your appetite. And in there's little links that will take you to the different patches we use for that. The last page has an email contact for Valerie, who's at the booth 103. And she can answer all your questions. Just kind of communicate with her, go say hi. She's sitting right here, red shirt, front row. And she can answer all your questions. If you're a health pro looking for a professional account, or you're an individual who just wants to buy a patch, talk to her and she'll give you that answer. Real quick, because I'm probably running out of time, in my surgical practice, every single operation that I do, I have run a no narcotic practice for many years now. Narcotics worsen outcomes. It's been a challenge because how do you control pain? Narcotics initially are very effective. So I like to use these patches as part of my enhanced recovery. There is a healing sequence to every injury. The injury occurs. Blood clotting has to happen. Clean out dead tissue has to happen. Collagen has to be laid down by the human body and then recreate soft tissue on the collagen matrix. That happens for every injury, whether it was a purposeful surgical one or you just twisted your ankle while walking down the street. There are 8 elements in your life that you need to make that sequence happen properly for optimal healing. The first one is to make sure you're hydrated, right? Because every chemical reaction happens in an aqueous solution. The second thing you need is improved blood flow and a coordination of your immune supply. And the Defend patch has actually been shown to allow for a better coordination of your blood flow and then also for an improved immune response. And we do have more double-blinded studies in the pipes on Defend patch. I force all of my patients to take a very high protein diet and a collagen of their choice. I don't care what it is, as long as it's organic and non-GMO, and I prefer grass-fed animal protein personally as a collagen source. But you can actually improve the amount of collagen you put down in places in your body with something called a Lumi patch. And that paper's on the way of being published. So you add a Lumi patch to improve your collagen deposition to help you heal properly. This is the same slide I just showed you. Your microbiome is critical for everything. Stop being so mean to your gut. Trace minerals. People are exposed to glyphosates. Glyphosates remove your body's ability to absorb micronutrients. You need to take micronutrients. And control the inflammatory response, and you're going to do that with that Defend patch. Controlling pain, there's something called a Freedom patch. In my ERAS protocol, I have patients use this as close to the incision as possible. I let them take Tylenol and ibuprofen. I have them take turmeric, boswellia, N-acetylcysteine, arnica montana, and then the Freedom patch. And then, of course, we have double-blinded studies. The main one is out of University of Miami, a placebo-controlled study. And then we talked about stress for the weight loss thing. It's kind of same. I'm getting ready to engage in a study to prevent falls in the postoperative period. We call this the PROTECT study. 1 million people a year will fall in a hospital setting. 10,000 of those people will die as a result of that fall, remarkably. And so we're going to do a study to see if your improved balance that we know you get with the Liberty patch, is it clinically relevant in the hospital setting? We don't know that. The study is going to occur. Right now, I would say use it. I have my patients bring it with them to the hospital. I just don't have the scientific evidence to prove that it works. So basically what I am saying is you truly can heal yourself if you kind of understand what's going on. You don't have to resort to pharmaceuticals to do so. You can use physics instead of chemistry. And again, a reminder about our last booth. It's right there, right in the you know, where the vendors are. And please visit. So, do y'all have any questions? I'm sorry I went over a little bit. I got carried away. Yes, question.
Wow, just wow. Do you have a question over there?
Did you have a question? Yes.
Yes, okay. When you were talking about that, the testing on that QR code.
Yep.
for that,
Yep.
So, do you need a doctor to read those?
No.
or-
No, that's what's beautiful. So here's the problem, and I'm not here to stand between anybody and a paycheck, okay? I know there are a lot of doctors who will charge you about $500 to run a microbiome test. And then they'll charge you about $2,000 to interpret that test for you. And in fact, I looked at that very testing system for my own office, and I will tell you, the doctors who are giving you advice are giving you crap advice, because I have seen with my patients what they are being told. So what they spend $2,500 on, often not worth it. For $275, like, you cannot beat it. It's an app. They're gonna ask you questions. You send off your little thing. 3 or 4 weeks later, in your app, it's gonna tell you, and I'm here to break your heart, your favorite foods, it's gonna tell you to stop eating. How the hell do they know I like chocolate and strawberries? But that shit was on my list of don't eat, right? So you're gonna not eat what you're accustomed to, and then it's gonna tell you eat stuff that you're thinking, there's no way I'm gonna eat a sardine. Well, you know, who's eating sardines? Why not? Yeah, no, friggin' cracked open a first can of sardine in my life because of it, but it completely changes your world. Completely changes your world. So my daughter, who was having just like a nervous breakdown on all the ADD medicines, and they were adding medicine on top of medicine, she has gut issues, that was making it all worse. Microbiome testing, focus patch, peace patch. The child is completely normal. She just got hired on by Sony Music as a royalties coordinator. So you know, she's a successful human being, and 3 years ago, oh my gosh, what are we going to do? You know, like she was a basket case. So straightening your microbiome has to be your number one thing in your health, and you're not gonna do it without parasympathetic homeostasis and a clean diet. And what I love about the Viome, it's gonna tell you, we're all creatures of habit. You're eating the same 3 protein sources, you're eating the same 5 veggies, because that's what you know how to cook, it's what the family likes, and it's what you're doing every night. Which means you've got a limited microbiome. Add some antibiotics to that, you're screwed. Add the artificial sweeteners and colors and stuff, you're screwed. And it puts you out of whack, and then boom, and now you got disease. Upset gut, and now you start taking omeprazole. Now you're really screwed. So anyway, all right, I digress. Yes, question? Yeah.
Did you say that we do the microbiome test through your website?
Yeah, you can go, like, I have a link to it, but that ought to be, not that one. Here, I'll get it. You follow that QR code, it gets you to viome.com. It's just sometimes no one knows how to spell that when I say it out loud. Well, it's easier to take a picture of it. And they do oral microbiome, they do some DNA testing also. And I have a huge Instagram following, and I have a lot of people in Europe. There is a company, and I have their link on my website, out of Europe that does the same thing, because Viome will not do international, they won't do Canadian. But Stride Healthcare does Canadian, because they're out of the UK and the UK. So anyway, if you go to my website, you can see the testing. There's 3 that I have on there. Viome, Thorne, and Stride are the 3. Anyway.
Your website again is
DrAnnaToker.com. And you just go to the tab that says Doctor Approved. Doctor Approved sounds kind of fancy. And you'll see the companies that I sit on the medical board. Super Patch is one of them. Zyve 7 is a digestive product. That's another one. Keep scrolling, you'll see the testing. And then I have cool stuff on there, like apps you can use on your phone to get clean food, one that's for supplements, you make sure you buy, those are free apps. Food delivery systems like Green Chef and Hungry Root, these are clean. If you don't know how to shop properly, all that's on the Doctor Approved on my website. All right, what else? Yes, ma'am.
It mentioned that if you had like nerve damage
Yes.
or like a brain.
Yes?
So if somebody's had experienced a TBI,
Then it may or may not work. So I have plenty of patients who've had a prior stroke, prior brain injury, MS, and it still works in those patients. Every now and then it won't work, and the only other explanation is going to be you had a car accident, it hit your head, and that's just one of the pathways that's screwed. So don't know, but it can be extraordinarily helpful. I will also tell you, if you have any neurologic problem whatsoever, that person needs to be on a clean diet, have them do the microbiome testing, straighten out their microbiome. All of your neurotransmitters come from the bacteria in your gut, all of them. So you gotta start there anyway. But if you did a clean diet and some of the super patches, depending on the symptoms this person might have, then you will find that it vastly improves the quality of their life. Will they be perfect? Absolutely not. I would never say that. Will it make an improvement? 99% chance that it will. Okay? All right, what else? Is that it? Yes, sir.
Yesterday, this is probably yesterday, you said that xylitol was on your list of bad
Yes?
sweeteners. What does it do? Because my dentist has got me addicted to that.
Look, my mother is a dentist, okay? I'm just gonna tell you, so I understand dentists. This is why I'm a sugarholic, okay? There's never any sugar in my house. My brother and I used to sneak out and just like gorge on gummy bears, okay?
Well, it's not just replaced.
So xylitol is designed, it is an antimicrobial.
Right.
It is a natural substance, so you can find organic xylitol. It is an antimicrobial designed to kill periodontal organisms. Here's the problem. Enough of that, you're swallowing, you're killing organisms in your gut. Okay? So artificial sweeteners and sugar alcohols, there's there are 4 exceptions in the natural world that don't seem to hurt the microbiome, that might actually help the microbiome. The first one is called allulose. It's a sugar you can find in figs and raisins. One is called erythritol, and erythritol in certain amounts has been shown to be a prebiotic fiber. And then you've got, we don't think that causes a problem, stevia and monk fruit. But xylitol should never go down the hatch. So if it's in a toothpaste, okay. If it's in a rinse and spit, okay. But if it's in gum or a mint, I would say don't do it. In fact, instead I would do an oral biotic, streptococcus, what is it, denta something or other, right? So there's a auricularis maybe? I don't know. I know there's an organism. And they come as little chewables, and they taste kind of like chewable yogurt. And that is a probiotic for your teeth. An oral biotic, basically, an oral probiotic, if that makes sense. Much better than any kind of xylitol. In fact, my mom at the end of her practice stopped suggesting xylitol, and instead you can outcompete periodontal disease with a proper probiotic. So you don't need the xylitol.
And so now we're hearing that stevia is a hormone disruptor. It's bad. Is that true?
I have not heard that, and it probably depends on how much you're doing. And it also depends on if it's an organic source. Here's the problem: if you get a non-organic source, it's exposed to glyphosate, which is a known hormonal disruptor. So you have to know what the study, what's the source of that information. What were they testing? It's like when people tell you whole grains is better for you than like regular, like white bread. Well, they're both trash, but there's never been a study against someone who's not doing a grain whatsoever, right? So you got to read the study. It's critical. The science matters. And so knowing what your source is and finding some dude who looks good on TikTok is not your source, okay? So you want to make sure that it comes from a real scientific study.
Really quick with the bio,
Yeah.
I just got my supplements from them
Yeah.
before I even knew.
Yeah.
And as a hygienist, I wanted the toothpaste.
Yes.
And in 4 days of me using it, I have less plaque buildup.
Yep.
It's wild.
Yes. Yeah, no, crazy, right? Do they offer a tooth? I know they do an oral health.
It's the highest test.
Yes.
That is your saliva.
Yes.
blood, and stool.
Yes.
You can do oral. Yeah.
Fantastic. Yeah, so I'm a firm believer that Viome stuff, I'm telling you, it's, and for the price, you can't beat it. And again, I'm not here to take, if someone's charging $3,000 for microbiome testing, please do not stab me in the parking lot. I'm just saying there's a cheaper way for you guys to get, I think, a better answer straight to your phone. So.
Beautiful. Ladies and gentlemen, give it up for Dr. Anna Toker.
Yay.
And we're going to do one over